Hi students, today the topic for discussion is clinical assessment of a sick child. Alright, so whenever any child comes to your outpatient, the first and foremost thing is to triage the patient. What do you mean by triage? Triage means you need to identify the baby whether the child is sick or not. If the child is sick, you need to give importance to those children who are all sick rather than giving importance to children who comes with cough and cold. So first let us know how to triage the child, how to pick up the danger signs whenever any child is present in your outpatient OP. And remember, each and every secretary of yours and each and every person who is in charge of sending the outpatient children to your consultation room should be aware of all those red flags. What do you mean by those red flags? So you all know that. So the red flags means identification of danger signs. So what are all the danger signs? Let's see. So the basics, first of all, you need to know is what is the basic thing. We all know that your oxygen and the blood is supplied by two important organs. What are all those important organs? Your circulatory system and respiratory system. Your circulatory system is the one which supplies oxygen in the form of hemoglobin to the tissue. Okay, your respiratory system carries the carbon dioxide from the tissue to the external atmosphere. And these are all the main suppliers. That is your cardiovascular system as well as the respiratory system, your heart as well as your lung. And who are all the consumers? There are so many consumers, but as far as your pediatrics is concerned or any other system is concerned, the main consumers are your brain, kidney and skin. Brain, kidney and skin. These are all the consumers. So what are all the things you need to assess? Assess two vital systems. What do you mean by two vital systems? You need to assess how the circulatory system is working and how the respiratory system is working, how your heart is functioning, how your lung is functioning. Second one is you need to assess the end organs. That is, if your heart is working well and your respiratory system is working well, your end organs such as your brain, kidney and skin will automatically work well. So how to assess these things? First of all, so high risk assessment. What do you mean by high risk assessment? You need to assess the airway, you need to assess the breathing and you need to assess the circulation. And appearance. Appearance means whether the child is dull looking or toxic looking. Okay, whether the child is playing or whether the child is over the mother's shoulder. Any child who is over the mother's shoulder should be considered as sick unless otherwise proved. Okay, I repeat, any child, okay, who is over the mother's shoulder and sleeping should be considered as sick unless otherwise proved. Airway means how the oxygen is going inside. Whether your upper airway, that is from the nose to the trachea and bronchus, is patent or not. Second one is breathing. Breathing means your alveoli is working well or not, so that when the air goes inside, the alveoli works in such a way that it supplies oxygen to the tissues. And then finally, the oxygen is going into the blood, but it has to be carried to the end organs with the help of your RBCs, with the help of your RBCs, and that can be transported with the help of your, what is that? Help of your circulation, that is cardiovascular system, right? Appearance. What do you mean by appearance? There are so many things which are noted here, whether the child is alert, lethargic, drowsy, restlessness, confused, disoriented, unresponsiveness. But as far as pediatrics is concerned, you need to ask only two things: whether the child is lethargic, whether the child is unconscious. Lethargy means there will be some amount of response. Unconscious means there will not be any response. Whether vomiting everything, whether the child is vomiting everything or not able to take feeds, These are all the four general danger signs that is explained in IMNCI. What do you mean by IMNCI? Integrated Management of Neonatal and Childhood Illness is called as IMNCI. In IMNCI, you need to ask whether the child is playful or not, whether the child is responding to you or not, whether the child is vomiting everything and not able to take feeds. These are all the general danger signs. And instead of asking all these questions, you can ask just four things. What are all the four things that you need to ask? Just four things. That is AVPU. What do you mean by A? A stands for alert. A stands for alert. Okay. A stands for alert, means the child itself is responding well. V for verbal. Okay. Verbal means what? The child is not alert as such, but when you call, when you ask something, the child responds. This is called verbal. P. P is for pain responsive. Pain responsive means the child is not responding to you, but whenever you pinch, the child moans. Pain. And what is unresponsive? Despite all these things, despite pain, the child is not responding to you. So alert gradually descends to unresponsive when the child's cortical development, not cortical development, when the brain is damaged. That is, your end organ is damaged. So whenever you see a child alert, verbal, pain responsive or unresponsive should be assessed. As far as an integrated management of neonatal and childhood illness, ask whether the child is lethargic, unconscious, vomiting everything, or not able to take feeds. Second one, respiratory system. How you are going to assess the respiratory system? First, general well-being you have assessed. Now you are going to assess the respiratory system. Respiratory system assessed in the following dicta. Whether how is the airway, how about the breathing, how about the work of breathing or retractions, and finally you auscultate. It doesn't mean that each and every time you need to keep your step over the chest to find out whether any Krebs is there or not, wheeze is there or not. By just simply looking at the respiratory system, by just looking at the chest, you can get so many diagnoses. So airway breathing, work of breathing and auscultation we are going to discuss. What do you mean by the? First of all, whenever you see any baby, you assess the respiratory rate. The rule of thumb is whether it is less than 10 or more than 60. More than 60 means tachypnea. Remember, tachypnea is the earliest sign of respiratory distress. Any child who is having pneumonia, for example, the most common things that can occur in a childhood period less than 5 years is pneumonia. So whenever you see any child with the respiratory rate of more than 60 per minute, it is mean by tachypnea. That is the first sign of respiratory distress. And what is this bradypnea? Bradypnea means less than 10 per minute. Remember, bradypnea is a terminal event. It is an ominous sign. It means that you need to intubate the child. So the rule of thumb is less than 10 or more than 60. Tachypnea is the earliest sign of respiratory distress, whereas bradypnea means it is the terminal event. The child is going to die, and so it means that you need to intubate the child. Second, normally you don't hear any noise during respiration. You will not hear any noise during respiration. Do you hear any noise? The inspiration is quiet as well as expiration is quiet. So what does it mean? Clear airway does not produce any sound. Whenever there is an obstruction, either in the upper airway or lower airway, it indirectly indicates that there is some kind of obstruction either in the upper airway or in the lower airway. How do I know that the sounds are produced from upper airway and the lower airway? Remember, upper airway, particularly from nose to larynx, particularly glottis, mainly manifest in the form of stridor. What do you mean by stridor? This is called stridor. Okay, so this is called stridor. Whenever you have inspiratory noise, particularly stridor, it indicates that there is an upper airway obstruction, particularly at the level of the larynx. Right. Then comes your noise during expiration. It can be of two types. One is wheezing or grunting. Wheezing indicates expiratory airway obstruction, particularly it occurs in asthma, whereas grunting indicates that there is an alveolar damage. Most commonly it is pneumonia. And what is called grunting? Grunting is nothing but the expiratory sound takes such a long time to come out because of the partially closed glottis. Okay, so you don't hear any noise during breathing. If you hear noise during breathing, it indicates that there is some kind of obstruction. Stridor indicates upper respiratory obstruction, whereas grunting and wheeze indicates lower respiratory obstruction. Okay, now predominant retraction. This was discussed even in our previous section. Last Wednesday or Thursday we discussed, I think. So whenever you have predominant retractions, it indicate that site is particularly affected. Suprasternal retraction indicates laryngeal pathology, upper airway obstruction. Whereas subcostal retractions, here the place where your chest and abdomen joints is called when those area goes inside and coming out is called subcostal retraction. That subcostal retraction indicates lower airway obstruction, particularly it can be an attack of wheeze, asthma. And finally, parenchymal disease, usually associated with intercostal retractions. It means the most common cause is pneumonia. So when you have suprasternal retractions, the answer is stridor, upper airway obstruction. Subcostal retractions means expiratory airway obstruction. Intercostal retractions means parenchymal pathology. So this is how you can get diagnosis even without seeing the child. Right, finally auscultation. Remember, auscultation, you need to auscultate over the apex, okay, axilla, anterior chest wall, posterior chest wall. Actually, you need to compare the air entry of right side with respect to left side, or left side with respect to right side. And then whether normal vesicular breathing is here. Whenever air entry is reduced on one side, this side is reduced, this side is normal. Whenever you have a differential air entry, that means air entry is reduced on one side but normal on the other side, means the most common finding in pediatric age group is foreign body. Whenever air entry is reduced on both sides, or it can be a pre-terminal event such as bradypnea, or it can be rarely due to central foreign body. Bronchial breathing indicates pneumonia, crepitations indicates pneumonia, whereas wheeze indicates expiratory airway obstruction. In that wheeze, whether it is responding to salbutamol or not. If it is responding to your salbutamol, it is asthma. If it is not responding to salbutamol, it can be a foreign body. Right, and finally, let's come to the circulatory system. And we are going to see how about the heart rate, capillary refill time, skin temperature and blood pressure. And then you need to look for whether cyanosis is there or not. Central cyanosis means your tongue as well as your peripheries are blue. Your tongue as well as peripheries are blue. It is mainly due to hypoxia. Whereas peripheral cyanosis means tongue is pink, whereas your nails are blue. This is mainly due to poor perfusion. It can occur as a result of shock, or it can occur as a result of hypothermia. So central cyanosis means heart is not working, or your oxygen is not delivered, central cyanosis. Whereas peripheral cyanosis means it can be a cardiac shock, cardiogenic shock, or it can be due to what? Peripheral cyanosis, hypothermia, that is peripheral vasoconstriction. Both in cardiogenic shock and hypothermia, there is peripheral vasoconstriction, as a result of which you will get cyanosis only in the limbs but not in the tongue. And then what is called tachycardia? Remember, tachycardia can occur due to so many things. It can occur as a result of fever, pain, or it can be a first manifestation of shock. And always you need to compare your heart rate with your respiratory rate. You all know that the normal heart rate of ours is 70 roughly. Our respiratory rate is around 50 to 20. So always there is a ratio maintained between heart rate and respiratory rate. When this ratio is altered, then the pathology you can identify with respect to either cardiovascular system or with respect to the respiratory system. Let's see. So remember, always roughly it is 4:1 ratio. That is, for every 4 heart rate there will be 1 respiratory rate increase. When the ratio is increased, that is, heart rate is increasing more compared to the respiratory rate, then it means that your heart is damaged or you have some pathology in the heart. Whereas when your respiratory rate is increased compared to your heart rate, altering this 4:1 ratio, then there is a pathology in the respiratory system. If proportionally both heart rate and respiratory rate are increasing, then it occurs due to septic shock. Okay, what do you mean by capillary refill time? So look at this, look at my finger. When I pinch this finger for about 3 seconds, I look at this. Let me pinch my finger for about 3 seconds and I will leave. Look at this, there is a pale area and suddenly it becomes pink because of capillary refill. So when my circulatory system is working properly, this capillary refill time is less than 2 seconds. That means you pinch for about 3 seconds and leave it, that the pale area becomes red within 3 seconds, not even within 2 seconds. That is called capillary refill time. Remember, we usually assess this capillary refill time not in thumb but in the great toe. And remember that it should be above the level of the heart. Which one? That your lower limb should be above the level of the heart. So capillary refill time is usually less than, that means it takes just less than 2 seconds that blanchable area to become red. So how to see was explained to you. So limb should be elevated above the level of the heart. Pinch or blanch the ball of great toe. After release of pressure, note the time taken for the place to become pink. Okay, so capillary refill time means, if poor means your circulatory system is not acting properly. In that way you can assess. Finally, skin temperature. How to assess? Keep one hand over the above, keep one hand over the lower limb, or another hand over the, keep one hand over the abdomen, or another hand over the ankle. Okay, so and then what you need to do, you need to run the hand which is over the legs. So gradually you need to see whether, so simple, keep one hand over the abdomen, another hand over the ankle. If both are warm, it means that the circulatory system is working properly. But if thigh is warm but ankle is cool, what does it mean? There is shock, there is peripheral vasoconstriction. And if thigh is warm whereas your shin is cold, again poor peripheral circulation. Again abdomen is warm, your thigh is cold, still more poor peripheral perfusion. So what does it mean? If cold to touch means, look where the place that temperature demarcation is present. If this temperature demarcation moves towards the center, it means the child is worsening. That means the child ankle is cool, okay, relatively acceptable. Shin is cool, still more shock. Thigh is cool, still more shock. So this is when this line of demarcation moves gradually upwards, the child is worsening. Whereas even up to the great toe, that the peripheries are warm means, then the child is said to be improving. This is how you need to assess the skin temperature with both your hands. Just roll the hand over the dorsum of the child's foot and you can identify where the demarcation line. Proximal the demarcation, poorer the prognosis, or the child is ill. Distal means the child is improving. And finally, this is rule of thumb. Okay, normally we see if the infant blood pressure is less than 70 millimeter per mercury, the child is said to be in hypotension. Between 1 to 10 years, less than 70 plus age into 2. So what does it mean? If the child age is 4 years, when will you call it as hypertension? 70 plus 4 into 2. 70 plus 4 into 2. That means what? 78. So if it is less than 78, the child is said to have hypotension. And more than 10 years, roughly less than 10 millimeter, 90 millimeter of mercury is said to be hypotension universally. Okay, and finally, if your sensorium is altered, it means your brain is not working. If your urine output is reduced, your kidney is not working. If your capillary refill time is high, the skin is not working properly. Okay, so appearance, airway, breathing. So finally, to conclude, appearance means alert, verbal, pain, unresponsive. Alert, good child, unresponsive, bad child. Airway means stridor, upper airway obstruction. Wheeze, grunting, lower airway obstruction. When you hear bubbling sounds, it has a terminal event due to pulmonary edema. And finally, breathing. Breathing means tachypnea means it is the earliest sign of respiratory distress, whereas bradypnea is a terminal event. Circulation, tachycardia, cool pale skin, prolonged CRT, hypotension are the ways to assess it. Whereas breathing means look for the respiratory, look for the retraction, look for the air entry, look for the added sounds, and look for the cyanosis. Remember, cyanosis in respiratory system illness will be associated with retractions, so much of indrawing, whereas cyanosis with respect which is due to cardiac pathology will not be associated with that much of retractions. So this is summary of risk assessment. Thanks for your patient listening. Bye bye.